Right. Good afternoon, and I'm here today. Dr. Yaffe's on a federal, provincial, territorial call and working with our counterparts across the country on some various items and issues to get national consensus and coordination in response to the COVID-19. So I'm going to do some numbers and talk about because what has happened since Monday, and then what are we looking forward on going to the weekend ahead. So we're trying to get some more of a trend type look on how things are changing and progressing, as well as just commenting the ups and downs of each day. It's more of overall, how is the overall numbers, how are they flowing, and how are they indicating directions at this time. So first of all, in our cases, we have 356 positive cases reported today. And you'll see that's up a bit from yesterday, and that means our total is 29,403. And as usual, most of our cases, pretty well 80%, are from our GTA type health units, Toronto Public Health with 181, Peel with 46, and York Region with 55. And I'll comment about some of that breakdown in a moment. And so we see that trend has and continues to occur. And so we're seeing most of the cases in Central East and the Toronto regions of Ontario. We did see some increases in the public health jurisdictions early in the week. That was related to outbreaks, and I'll be commenting on that in a moment, mostly in the Haldimand, Norfolk, and the Niagara areas related to outbreaks in the migrant farm working communities and employment sites. And so we continue to work with them, along with the UMAFRA, Ministry of Agriculture, Food and Rural Affairs and Labour, as well as Training and Skills, Labour and Training and Skills Development, to deal with the food sector with migrant workers and the larger agri-food sector. So we'll comment on that. The number of healthcare workers, total cumulative so far or since January, 4,854. And that was an increase of from yesterday's last one of 57. While our hospitalization and ICU rate of healthcare workers has stayed basically the same. There are 760 people in hospital, that's a decrease of 15. And the number in people in ICU is 121, a decrease of 6. And those in ICU on ventilator is 94, that's an increase of 2. We still see deaths, and we had an increase of 45, which was a significant amount, even though in the long-term care admin data, they only reported an increase of 18. So we're trying to ascertain where these other ones had occurred, or is it more data being entered and updating those files accordingly. The long-term care retirement homes, they list 166 active outbreaks, while on their long-term care data, they have actually demonstrated a drop of another 5 outbreaks, so that continues to be in a positive direction. Meanwhile, their residents and their staff cases continue to drop as those cases resolve, and the amount of people that are still in the active caseload is diminishing here in that, and the cumulative numbers, while they have some meaning, I don't have too much of the 5,202 cumulative in the residents and 1,865 in the confirmed cases in the staff. But again, it's more what is happening at this time. As I said, each day now for the last number of days, those have been dropping as those people have out of their period of 14 days and have resolved in that regard. There's still 5 deaths reported in the IFAS in the workers and 1,509 cumulative deaths in the residents in this time here. And as I said, they had reported in administrative data an increase of 18 deaths. Retirement homes seem to be staying fairly stable. There are 36 homes in Outbreak. That was an increase of 1. And they had 192 deaths reported, which was the same as the last time. And again, their cases in the residents and their staff members are decreasing as well as they go through their period of observation and are resolving in that regard. On the lab testing data, we did yesterday 2,822. That's a new high for us in the province. Again, we've only had one day before that where we were over 20,000. And looks like the ones pending, it's not going to be that much lower, if not the same tomorrow. So we'll have to wait to see what that shows in that regard. So that means our total number is 786,323 tests, which is the most by far of any province and territory in Canada. So the data, and that shows us there. They're saying what happened during the week there. And from when we started off on Monday with over 400, and we went up to 446, then came down to 338, and we're back to 356 here. And what we're seeing, as we said yesterday or before, is in the 446 when we jumped up, 100 of those were just due to the numbers reported of the outbreak in Haldeman, Norfolk, as they looked at their over 150 positive cases that they had detected through broad testing of all the employees of that facility. And they found over 150 positive cases. And they had a few more entries yesterday, but today they have no new cases to report. Niagara was the same, as they had an outbreak in a smaller type entity, and those numbers added to that 446. So in essence, if you take those out, we're about where we are for the rest of the week in this sort of plateau range. But adding to that one there, as we're looking at our cases here, are ones that are not epi-linked. That number continues to drop down from the 50 to 40% into the mid and upper 20s in there. So a lot of these ones now are being linked into outbreaks. And certainly in York Region, when talking to their medical officer of health, of the numbers that we reported that York Region had noted in our data, most of those are all related to outbreaks in various companies. And a lot of them are not residents of York Region per se, and they come from other parts of the Greater Toronto Area. Peel is also reporting that some of those numbers of theirs are outbreak institutions as well, and Toronto has some as well. So we're seeing this shift from high numbers in the long-term care as they've finished that survey, the numbers in the general public coming out, because even in the testing, I had noted there, but I will note that our positivity rate, which had gone up to the mid threes, is back down now to 2.1%. That's our lowest in a long time. That was a decrease of 1.7%. I think that's what happens when you're doing a lot more testing in the general public. Even those with symptoms and those with exposure, we're seeing a much lower positivity rate in that group there. And the shift is from where in the past we had a percentage of those over the age of 60 was in the 40s, upper mid 40%, is now dropping down to 38% in that. But the GTA focus is becoming stronger, as we said in our notes, heading up to 66%. So we're seeing this shifting around. And we're still seeing some cases out in the other health units. About 14 or 15 reported no cases in the last 24 hours, in IFAS, that is. And so we're seeing others in 1, 2, 3, or 4 cases, except where we have the outbreaks and ongoing aspects in like Windsor, Essex, and in Ottawa, and as well as the GTHA with Hamilton included. And those are in the numbers under 30 in each of those jurisdictions. So we're seeing a lot more under our, what I call, there's case contact and there's case investigation. And in Ontario here, we do a lot of intense case investigation. That's where we detect not only the case, but we find upstream that it was at a locale, and we find out if it's in a outbreak mode, we test all the staff, and we may uncover a lot more cases that were unknown and wouldn't have been known to us unless we did that investigation. And so we're doing that so well now in Ontario. Outside of the retirement homes, we have well over 700 outbreaks in various institutions that have been detected by public health, and that gives credence to the case contact management, or more precisely, the case investigation system. So we've had some announcements. We're continuing to look at where we might go with our staging, our metrics. Our R0 had been over 1. It's come back down to 0.9. Some parts of the province are well below that. So we're continuing to monitor that, as well as our positivity rate, which as I said is low, and other investigations. So we're trying to look at recommendations, how we might consider when we move to the next stage or not. And ideas are being worked around, much like the other provinces and territories, around ideas of so-called bubbling and that kind of stuff. So we hope to have some announcements next week in regard to those two issues there. But right now we're holding our course as we have like this plateau around this 300 level. So with that, I'll take questions.
Okay, we'll move to the phone line for questions. Just a reminder, one question, one follow-up.
Your first question comes from Cynthia Mulligan with City News. Please go ahead.
Hi, Dr. Williams. I hope you're well.
Yes, just dry air. Thank you.
Okay. I was seeing some articles on the spread across Canada, and we heard from the federal government today that they feel that it's going in the right direction and it's heading downwards. But it seems that Ontario and Quebec are the driving forces still. And I'm sensing that Quebec is taking an even maybe faster, is not quite the right word, but going down a little speedier than we are. So are we in Ontario, the province, kind of holding everybody back?
No, I don't think so. I think as we're looking at our data, you can see most of our issues are in the dense urban settings. In there, as we said, most of our numbers, if we take out our current one, nearly 300 of the 356 are in the GTHA area. And so we're trying to determine that. A lot of them are outbreak related. And we understand a lot of the other provinces and territories haven't got the same number of outbreaks that we've detected. So with our enhanced testing, we're going out looking for cases. Some have done various versions of that, but we are certainly doing it in a robust way, as the Premier has asked for, not only going after symptomatic, wide symptomatic, and any symptomatic to people with risk exposure, either known or perceived. And so we're certainly going out and, I would say, close to about beating the bushes, looking for cases. And I think it's better to know we have them and just not to assume they're not there in that regard. So we're trying to do that. That may keep our numbers up at the moment, but it means that our case contact management will be enabled and even more robust so that we can not only get down off the curve, but we want to stay down there. And if we can, even prevent or try to avoid a second wave. That would be nice, but we have to wait and see.
Follow up?
Thank you. And in looking at the numbers on how COVID-19 is spreading, I see on community spread, there were about 145 more cases today from yesterday. Are you encouraged by that? Is the community spread the biggest fear? I know in close contact spread, when it's in workplaces, at least you can trace it and track it. But is it the community spread that you're most concerned about at this point?
Right. Now, what I call community spread, we're calling now a term with no epidemiological linkage. And there's some that have no information, means they're not completed the investigation yet. When I look back at the end of May, those type of epilink cases were ranging from 130 up to 210 each day in that number there. Lately, that number has been coming down to the ranges of around 100, less than 100, around 80. One day it popped over to over 100, but then back down again. So we're seeing the no epi link cases the last while have been coming down, and that's encouraging. So in essence, more cases are linked to epi cases, which I said a lot of them are linked to actually known outbreaks within various work settings, and that's a shift that we're seeing over the last week or so.
Next question.
Your next question comes from Jessica Smith with Queen's Park Briefing. Please go ahead.
Hi, Dr. Williams. This morning, the province announced that Jane Philpott would advise on the Ontario Health Data Platform, or I guess what used to be called Panther. I'm wondering if you can tell us how that new system will help you advise the province on what to do in this pandemic.
So the overall, I'm not going to give a detailed explanation of the Panther that can be coming out, and that's been working at, because all along, as I said, the key to us here is data and the quality of data, the robustness of the data, and the analytics around the data. And with a province the size of Ontario, as you've seen with the amount of testing, the amount of people, and the amount of variation, the complexity of the province, the segmentation of that data, the use of that data is tremendously important. And a group like Panther, and that looking at these databases, other databases, and big data in general is going to be very helpful as we look at the analyzing the complexity and the multifaceted aspects of a place as complicated as like the Greater Toronto Area, if you may, as an international hub, where in Canada, our equivalent is more to larger cities in North America, such as New York and Houston and others, and people are using that as a comparator. But that means we need that kind of data platform to carry out that analysis, and any more excellence in that area is highly applauded, and I'm looking forward to what they may be procuring or putting forward in the near future.
Follow up?
Can you explain if you have been given a timeline on when that will be up and running, and really just any other information you can give to explain sort of to a layperson what information you would have with Panther that you don't have access to right now?
We can get back to you on a report on that. Right now, they have some basic aspects of it up and putting together. They have a table they're putting together, and you've heard the announcement with Dr. Jane Philpott joining that table, and so that is being populated up. So it still is an action in progress, and we'll have some more updates as that table makes some announcements around the very questions you're asking about, but I don't have those with me today.
Next question.
Your next question comes from John McGrath with TVO. Please go ahead.
Doctor, I know you've talked a bit about this, but given that the numbers have been flat province-wide for the last week or so, I know you've talked a bit about how we're seeing a shift in terms of outbreak cases. But does the trajectory of the province-wide numbers change what advice you would give in terms of moving to the stage 2 of reopening, or is the trend within those numbers, as you've talked about outbreaks, does that mean we could go ahead to reopening next week, for example?
Mm-hmm. So that's a good point, and we have been we're trying to be cautious. We, as the minister has said and the premier, we don't want to have to go and then all of a sudden backtrack. Some other jurisdictions have had some challenges with the reoccurrence. Even in China, they've had some resurgence, and Korea as well. So we want to make sure we're moving steadfastly in the same direction as we open up. I think with the numbers there, and part of that is the play out is that in the past, when we were at the same numbers before, we were testing 14 to 15,000 a day. We're now 18 to 20,000. And even with that, with our positivity rate and outbreaks, it's not surprising that we have some higher numbers in there because we're testing more people. But that means we have much more confidence in the more comprehensive look at the population writ large. And I think that seeing that drop in the positivity means that we're being persuaded that it's not something hidden out there that we're missing, except in the workplaces, as I was alluding to, and we're trying to aggressively go at that and to contain those ones in that light there. So I think it means that we're being cautious, and we're also being aware that we have a variation in the province, and we've been asked to look at ideas around regional, and does that make sense? Because we have quite a variation, even in our knots. That terminology about the spread in the community is quite varied now, whereas in the past, even a week and a half ago, it was fairly consistent with even some of our outer areas around 1 and 0.9. Some have dropped down low, but they're smaller areas, and a few numbers would bump them back up again. So we're trying to look at all the metrics and see how we might move towards stage 2 and advise the minister and the premier and cabinet accordingly. So we're in those active dialogues at this time.
Follow-up?
Well, I'll just quickly say that if the province wanted to start providing the R0 numbers regionally in the daily data release, that would be great. But my follow-up question is about Toronto Public Health has said that they are struggling to do data entry quickly, just because in some cases, reports from provincial labs on terms of the testing have been arriving in faxes and often with duplication, and that is affecting how quickly they can get into contact tracing and isolating infected people. Is your office, is the command table, is somebody considering any kind of measures, an emergency order or otherwise, to try and clean up this process and perhaps maybe not use fax machines anymore?
Correct. And Toronto is unique in that, and so we're actually looking at methods that we might do to streamline and improve that for the city of Toronto. The challenge we have is that because COVID, like other diseases, is reportable, and that means any laboratory, if they get a positive test, that is a reportable incident, they have by law to report to their local public health unit. As you can assess when you look at the various laboratory networks, a lot of them are large hospitals that are located within Toronto, and some actually do tests on behalf of some jurisdictions outside Toronto. But yet, all those results have to go to Toronto Public Health because they're located in Toronto. That means Toronto then has to sift through all those and decide which ones are truly theirs and which ones have to be sent to other jurisdictions, whether it's to Durham, to York, to Peel, and elsewhere in that regard. So that is an extra administrative burden on them, let alone the ones they find that have incomplete information, and you have to pursue back to try and see if you can ascertain the clarity. So we've been having assertive meetings with our counterparts at Public Health Ontario, as well as our executive lead in testing and case contact management to see how we could alleviate that issue and to clean up that so that Toronto Public Health can look after their cases and they get the data in a clear and concise way that would only but streamline it. So we are working on that at this time, and we hope to have a solution as we keep driving towards that in the near future.
Next question.
Your next question comes from David Woodard with Global News Radio 640 Toronto. Please go ahead.
Good afternoon, Dr. Williams. We've spoken with a family member whose father passed away earlier this week from cancer. Now, it's their belief that COVID-19 hospital policies, specifically the ones that don't allow family members to visit their loved ones, sped up his deterioration. They say he developed cognitive issues where there were none before. He grew frustrated and sad that he couldn't see his family members. The family thinks that their father died sooner than he would have if he'd been able to see them. Now, the family says the reason that they actually couldn't see their father is because there's a lack of PPE for the public who want to go visit sick relatives. Is that the issue? And if so, when will that change?
Well, yeah, that is certainly a sad issue for the family and dealing with that. And we've had some other concerns with individuals who want to visit family members in long-term care facilities. I think you said this was an acute care center. I think. I didn't hear that at the outset. And I think each situation, their critical visitors are not only permitted, they're encouraged to come in and are given proper guidance as well as screening and PPE. So I think if there has been some challenge in that, they would contact the facility, and then if it's acute care, they could contact Ontario Health for some clarification on the matter. If it's long-term care, they could contact the Ministry of Long-Term Care in that. So we've always said that if there's life issues at hand, that the facilities have always along allowed a visitor in with proper screening, and they would be equipped with the proper protection for that very essential and critical visit. So if that's happened, that was most unfortunate, and concerns with that, but I wouldn't have the details and be able to answer the specifics on this case. I'm talking about the larger category. And even now we're looking at whether in our long-term care situations, whether we'll be getting some ideas of some enhanced regular visiting to those facilities with knowing that they're not in outbreak mode or at high risk, and how we might do that. So we're waiting for some guidance on that. But I think what you're talking about is a situation where an individual is in more of a critical state, and we've always wanted to have family members or a person to come in and be there at that time. So condolences to the family on that regard, but I would like they should check in with the hospital if it was an acute care or long-term care facility and the respective jurisdictions such as Ontario Health and or Ministry of Long-Term Care to seek some explanation in that regard.
Follow up?
Yeah, thank you for that answer. Is there a lack of PPE for visitations down the road? Are we seeing that there's not enough if we do expand this program?
A challenge for every jurisdiction, ours too, is to make sure there's adequate PPE, not just for visitors. We have to make sure that the essential services, as in our acute care hospitals, for their regular day-to-day business, let alone looking after the COVID patients, which our data still say is that they still have a number in their facilities right now in that. And as they are starting to ramp up some of their elective procedures, so they're getting back to business, those all require volumes of PPE. Our long-term care facilities are making sure that they are equipped to curtail any further impacts on mortality and morbidity among their residents, and a number of other health institutions, with the easing off of the directive, are starting to open their business and aspects and require PPE. So we want to make sure that those essential things have what they need to have to not only get open, but to stay open and protect themselves and the public. And then, of course, we have the visitors and other ones in there, and each setting is going to have different rules and jurisdictions. So it is a balancing act in that way to make sure that all are covered as best we can, while continually encouraging supply. And as you've heard many updates from the Premier, as well as working diligently to obtain all the supplies we need. And we're making progress in some areas, and some areas we still have to work hard at. So I can't give a blanket statement on that, but I can say that where it is possible and reasonable and feasible, we're trying to make sure that all sectors get it, and so they can open up and back and deliver the essential services that they would like to do as we open up in the different stages of the recovery.
Okay, we're going to move to the last reporter.
Your next question comes from Allison Martell with Reuters. Please go ahead.
Thank you. Given what we've seen among migrant farm workers this week, do you think it's time to test all migrant farm workers in Ontario?
It's a good question. We're not against testing all of them if we need to do so. Right now, as you know, we've done a number of outbreaks, and that's been very helpful to test all, not just the migrant farm workers, because there you have the actual owners of the facility. And what we found also with some of the migrant farm workers, some have been in for a long period of time, and we had them under quarantine, and we monitored them during that time phase, and they have been symptom-free. What's happened, sometimes we bring in some of the domestic migrant farm workers who come in from around the area where there might actually still be community spread, and that tends to potentially contaminate, if you may, or infect the migrant group, which are in usually close quarters and working close in the fields and that kind of structures. So in that sense, out of the 10,700 that have come in, the number is about 390 that have tested positive. So not a huge percentage in there, but we continue to be on monitoring that, and we're open that if they want to do some broad-based testing of some and some sampling, we could do so, especially those that have no outbreak or asymptomatic cases. And that's where some of the testing group under the leadership of Dr. Dirk Heyer are looking at some ideas, because you'd have to then have a mobile testing unit go out to those, because they are in rural areas. So these are all possibilities to look at. But the Ministry of Agriculture and Food and Rural Affairs is monitoring this very carefully. We have guidelines federally, we have guidelines provincially, and have been very stringent in ensuring all these aspects, including any cases found, are moved out and isolated during their period of time to ensure there is no ongoing communication of disease within the setting there. So it's a situation we're monitoring, and overt testing of a large group asymptomatic is not out of question. We could entertain that, and we'll be discussing that with the other centers in workplaces that have considered asymptomatic testing.
Follow up?
Whose decision is it?
To do it? To do the testing? One is our testing strategy group. So if they're going to do target population ones, whether it's neighborhoods or it's company A and company B, or it's out in another sector, there's a lineup, and of course you have to get the staff and the equipment and the mobile unit to go out there and undertake it. And of course, because it's not in an outbreak mode, the testing would be voluntary in there, because it's not under an outbreak order. And so you'd want to make sure that wherever you're going to go, that you would have the compliance of the owner, the manager, the employer, as well as the employees, if you're going to make it a worthwhile survey and study, and then to make sure you do it well, and that everybody's informed of the results in a timely fashion. So you want to do a quality job, and so those are all the factors that go into making that decision in there, negotiating, and that is that group, as I said, with a testing lead under Dr. Dirk Heyer, as they consider all the possibilities. So they would make those decisions based on many of the parameters I just noted.
Okay, thanks everyone.